The A4 pulley is the second most commonly injured pulley in climbers, right behind the infamous A2. In this video, we're going to tell you everything you need to know about how A4 injuries happen, how you can identify them, how to create an awesome recovery strategy, and of course, how long it'll take until you're back to 100%. By the way, this video is sponsored by Pitch 6, who make an awesome new force gauge called the Force Board. It's quite similar to the Tyndek Progressor we all know and love, but with a few key differences. If you like making finger training routines and even trying out other people's routines, the Force Board app is specifically designed to accommodate that. It's got all the functionality we've come to expect, along with some nice surprises, like a rep logging function that starts automatically when you start pulling, RFD logging with every rep, and total load over the course of your session. It also has temperature and humidity sensor, USB-C charging, and useful accessories. The creator of Pitch 6 is a Utah-based climber, engineer, and all-around nice guy, so we're super thankful to him for helping us make free content for climbers. Get $10 off your very own Force Board with our code hoopersbeta, available worldwide, link in the description. The A4 pulley is a short band of connective tissue in the middle segment of our fingers that helps keep the flexor tendon in place under load. If the load is too high, a tear can occur anywhere from a very small grade 1 to a full rupture or grade 3. This can even happen to a perfectly healthy pulley, like when your foot unexpectedly slips off of a hold, resulting in a major shock load to your finger. Naturally though, the likelihood of injury tends to increase if there's been any previous degradation of the tissue. This can happen over the course of a single session, like when performing a high-intensity crimp too many times in a row, but it can also happen over the course of many weeks if we consistently exceed our pulley's ability to heal and adapt between climbing and training sessions. With that second scenario, where the degradation builds up over multiple weeks, you may actually notice some symptoms from that alone, even if you never experienced a sudden acute overload of the pulley. We tend to call this a chronic or overuse injury. It's essentially an accumulation of minor tissue damage that leads to persistent inflammation, reduced tissue integrity, and pain. In my practice, I tend not to call this a grade 1 pulley injury because it's not the same as an acute sprain, but the recovery protocol is essentially the same between the two. So if your A4 injury is from overuse rather than acute trauma, you can simply treat it like a grade 1. Now you might be wondering why some climbers seem to be way more prone to pulley injuries than others. There could be a ton of factors at play, but here's one of the more interesting ones. You know how cats have those weird spines on their tongues that make them feel super rough in one direction but smooth in another? There's sort of a similar thing going on in our fingers, with ridges in the pulley tissue that increase friction between the pulley and flexor tendon in one direction. This helps us lock into a crimp under heavy load without making it hard for the two structures to slide past each other under lighter loads. Some individuals are believed to have more of this friction than others, which could be an advantage for grip strength. However, it could make pulley tears more likely if the hand opens up under heavy load, kind of like scraping extra hard against an extra spiny cat tongue. The amount to which this phenomenon actually contributes to pulley injuries is still being investigated, but I think it's worth paying attention to how frequently you allow your hand to open up on hard crimps. There may be some interesting correlations there. Let's identify the specific signs and symptoms of an A4 pulley injury. Keep in mind, you can make this a whole lot easier on yourself by using the free finger injury assessment tool on our website, which we specifically designed to help you understand the type and severity of your injury. Simply answer a series of multiple choice questions and get results. Please note this is for educational purposes only and is not a substitute for professional medical advice or diagnosis, but it's an awesome way to jumpstart your injury knowledge. Did I mention it's free? A grade 1 A4 injury, also known as a mild sprain, typically presents as discomfort or pain in the middle or base of the middle phalanx. This is technically a small tear of the pulley, but we call it a sprain to help differentiate it from more severe injuries. Grade 1 symptoms often appear suddenly following intense or repetitive crimping, but the pain tends to subside by the next day and there will not be any noticeable swelling. Palpating directly over the A4 region might feel mildly tender, but not particularly sharp. Grip strength will be largely unaffected in open hand positions, but will be affected by more strenuous crimping. With a grade 2 A4 injury or partial tear, the pain is more pronounced and tends to linger beyond individual climbing sessions. Pain from palpation will be sharper and a small amount of swelling in the A4 region can develop. It's not uncommon for the finger to feel a slight increase in stiffness when you wake up in the morning, and the finger may feel noticeably weaker or more sensitive even on larger holds. Even moderate crimping will clearly exacerbate the pain. A grade 3 A4 injury, typically referred to as a complete rupture, often involves a distinct popping sound or tearing sensation at the moment of injury. Pain or discomfort can immediately follow, though it may not start until the inflammation sets in. Swelling and bruising can appear relatively quickly, though not always since the A4 is so small. Grip strength will be significantly reduced, possibly accompanied by a feeling of instability or reduced range of motion. Visually obvious bowstringing, where you can see the flexor tendon pulling away from the bone under the skin, will not occur with a single pulley rupture, but can occur if multiple pulleys are torn. If you do see obvious bowstringing, you should be consulting with a doctor rather than watching this video. As you can see, the symptoms of A4 pulleys are pretty straightforward. However, there are a few other finger injuries that can present with similar symptoms. You could just use our self-assessment questionnaire to make this easy on yourself, but here are the other injuries to be aware of. Injury-induced pulley thickening, or IIPT, is a gradual buildup of disorganized, inflamed tissue that leads to noticeable thickening of the pulley under the skin. Flexor tendinosynovitis, which is chronic irritation of the sheath that surrounds the flexor tendon. A strain or tendinopathy of the FDS tendon, which can cause similar symptoms but closer to the PIP joint or just one side of the A4 region. A flap tear of the pulley, which is an unusual injury that requires medical diagnosis if you notice a catching sensation in your finger related to your A4 injury. As a climber myself, I know that pulley tears can be scary, but with the appropriate recovery steps, you'll have nothing to worry about. I've treated so many of these, and when recovery is taken seriously, climbers not only return to full strength, they often come back stronger than before due to the structured training regimen. The exact timeline can vary wildly depending on the quality of your recovery efforts, athletic background, genetics, etc. But for grade 1 injuries, you can expect a return to full strength in about 6 to 8 weeks. For grade 2 injuries, think more like 8 to 10 weeks, and for grade 3, about 10 to 12 weeks. Now to everyone's favorite part, recovery. Of course, your exact recovery timeline and exercise protocols should be determined by your grade of injury, but we'll do our best here to show you what you need to know. Or you could just save yourself the hassle by purchasing one of our affordable, proven recovery blueprints. Link in description. First things first, for all grades of A4 pulley tears, I recommend an immediate break from climbing. A small miscalculation could turn a small issue into a larger one, so we might as well avoid that possibility. Also, the brief deload helps us reevaluate any overtraining habits that led us to this point. For grade 1, you'll be off the wall for just about 10 days, for grade 2, 2 weeks, and for grade 3, 3 weeks. Don't worry, resting from climbing doesn't mean stopping all other physical activity, including finger training, which we'll discuss in a little bit. You'll just need to make modifications to keep any pain from activity at or below a 2 out of 10 and avoid aggravating your injury. For grade 3 injuries, you have to be especially careful to avoid movements that demand excessive grip force, like deadlifts and pull-ups. When you do decide to return to climbing, start with more open hand grip positions, avoiding small holds and insecure feet. Splinting and taping. The traditional guidelines for splinting and taping A4 injuries are as follows. For grade 1, neither is necessary, though taping can be determined by personal preference. For grade 2, supportive H taping is recommended during any exercise that involves gripping, including finger recovery activities, climbing, deadlifting, pull-ups, etc. For grade 3, a pulley splint is recommended to be worn 24/7 for 3 to 4 weeks before weaning off with supportive taping. I do recommend climbers stick to these guidelines for now, if possible, but I do want to note that new research is currently being done to evaluate the necessity of splinting for grade 3 A4 injuries. The reasoning behind the traditional guidelines isn't necessarily rock solid, so I'm waiting until the new research comes out to make more concrete recommendations. For now, if for some reason you can't or won't wear a splint, you should simply consider supportive H taping instead anytime you're going to do exercises involving gripping. Next up, manual therapy or massage. While research on the efficacy and mechanism of manual therapy is limited, I still recommend it because it's essentially a zero-risk potential gain situation. It costs you nothing and may improve your recovery, as its proposed benefits include tissue remodeling and reorganization, which can be useful across all injury grades. I typically recommend daily manual therapy for 3 to 5 minute intervals at an intensity dictated by your current level of irritation or inflammation. The main thing you want to avoid is going too hard or too long and irritating things further, so make sure you keep the pain at or below the usual 2 out of 10 pain threshold. Next up, simple range of motion work. This means fully flexing and extending your fingers in 3 different positions to encourage blood flow and tissue movement. Position 1 is at the bottom of the hand, closest to the wrist. Position 2 is in the middle. Position 3 is at the top where you may have palm calluses. To start, touch your fingers to position 1, try to move your fingers in an arc rather than immediately curling them into a fist, then fully extend your fingers and repeat for position 2 and 3. Perform about 4 to 6 reps per position multiple times a day throughout your recovery. I recommend this range of motion work for all grades, but it can be particularly useful with grade 3 issues to prevent tissue adhesions. We do not want to immobilize the finger and prevent the tissue from moving. Note, Sometimes with grade 3 issues, you may not be able to reach position 3 due to range of motion limitations. In that case, you should also work on passive range of motion, where you use your opposite hand to gently encourage greater range of motion than you can achieve actively, of course without causing more than a 2 out of 10 pain. Now let's talk about how and why we need to retrain the injured tissue with specific loading exercises. For grade 1 and 2, I like to start doing this immediately, and for grade 3, it's a good idea to wait a few days after the injury, but no more than that. Loading the tissue is critical for recovery because our bodies need a stimulus to kickstart adaptations, aka healing. The stimulus can come from just about any adequate loading to our finger, even climbing. However, climbing is not a particularly controlled environment. It's too easy to go too hard or not hard enough, making it less than ideal to optimize our recovery. So we should switch to a method that allows us to start at a consistent low intensity and gradually ramp things up as we heal. At a certain point, the recovery exercise will actually transition into a strength training exercise, allowing you to regain, maintain, or even improve your prior level of finger strength. Our initial tissue loading activity will be low intensity, high volume submax holds. You'll simply pull or hang on a 20 to 35 millimeter edge, depending on your grip position, with one or both hands for 30 seconds, rest for 30 seconds, and repeat. To help you gauge how hard you should be going with this exercise, use the following guidelines. Keep the discomfort or pain at or below the usual 2 out of 10 threshold. We don't want to be causing significant irritation. Keep intensity low enough that you do not feel fatigued at the start of each rep. Next, we'll want to vary our tissue loading tactics with a more dynamic variation. We'll accomplish this by performing band-resisted rows on a comfortable edge. We can modulate the intensity with the thickness of the band, the amount we stretch it, and the speed at which we pull. A band is actually preferred over a cable system here because it starts with minimal resistance and gradually ramps up, making modulating intensity more convenient during early recovery. To gauge how hard you should be trying, use similar guidelines: discomfort or pain at or below 2 out of 10, and no fatigue at the start of each set. Notice I said set there, not rep. If you have a force gauge, you can dial these in even further by seeing how hard you're actually pulling. This is by no means necessary, but it's another easy way to track your progress over time and helps you make more informed decisions about your recovery. Next, we'll be progressing our tissue loading with recruitment pulls, which add a beneficial neural recruitment factor into the mix. This is especially important when recovering from tissue tears because we quite often develop an overactive protective response to loading our injured tissue. Recruitment pulls, coupled with our other training, will help bring that response back down to normal levels while also helping to safely retrain our fingers. To perform recruitment pulls, pick a 20 to 25 millimeter edge and a half crimp position and pull as hard as you comfortably can over the course of 5 to 8 seconds, starting at low intensity and gradually increasing to maximum tolerable intensity within the first few seconds. Rest for a second or two, then repeat. This style of finger training should feel quite a bit different from the other tissue loading exercises, as all the force should come from trying to curl your fingers rather than simply stopping them from opening up. Speaking of neural recruitment factors, next we'll do a more advanced version of the mobile board rows. These will be the same as before, except that the pulling motion will be executed as quickly as you comfortably can. This will help retrain our nervous system and in particular our rate of force development, or RFD, to get us more accustomed to loading the injured tissue quickly. This can be a huge hurdle for climbers returning from injury, as we often become hesitant to commit to dynamic moves. Now that we're in the later stage of recovery and our pulley is getting stronger, we can perform these rapid rows without risking re-injury. I recommend you attempt a few pulls at a slower pace and increase the speed over a few reps so you can gauge your comfort level and resistance in the band. If you're unable to move at a quick pace without causing discomfort or pain, then you should decrease the resistance of the band, even if it feels fine at a slower pace. Once again, if you have a force gauge, you can measure your force or even rate of force development here, which gives you another useful metric to track over time. For example, if you measure your RFD each session and see that it's trending up without increasing in pain, you know you're making killer progress. Finally, we'll add block pulls, which are easily measurable, progressible means of finger strengthening. Block pulls are a yielding isometric as opposed to the overcoming isometric of recruitment pulls, which will help round out our finger recovery. Block pulls require a mobile board and attachable weights or cable machine, with the most common setup being a loading pin and plates. Simply use a half crimp position to lift the weight off the ground, and do this by straightening your legs rather than pulling with your back or arm. Hold for 1 to 2 seconds at the top before controlling the weight back down to the ground. To determine how much weight to use for your working sets, use the following guidelines. And if you can't maintain the half crimp position for the duration of each rep, i.e. your fingers start opening up partway through, you need to reduce the weight. Since this is meant to be an end-stage recovery strengthening exercise, you should be using as much weight as you can while still sticking within these guidelines. And don't forget to progress the difficulty by adding weight over time as your strength improves and pain reduces. These can be performed up to 3 times per week, but you may need to reduce that frequency depending on how much and how hard you're climbing at this point. We don't want to end up overusing the tissue and causing disorganized healing in this end stage, so if you're climbing 3 times a week, you may want to reduce the block pulls to just twice a week, or vice versa. Aside from the primary recovery activities, there are a few other things you may be curious about. Surgery is rarely ever recommended for an isolated tear of the A4 pulley, even if it's a complete rupture. It's usually only considered when multiple pulleys, like A2, A3, and A4, have ruptured, or if there's a flap tear, which we noted earlier. Icing always gets brought up because it can mildly reduce swelling and pain, and contrast baths are said to have similar effects along with increased blood flow. However, I generally don't recommend either of them for A4 injuries because they rarely have swelling, the pain is not particularly intense, blood flow can be increased with simple range of motion activities, and neither intervention is all that convenient. You can certainly try them out and see what you think, but don't let them take away from the most important aspect of your recovery, a well-designed finger loading protocol. It is, of course, impossible to avoid all injuries, but I think there are some things we should all do to help reduce risk. Avoid repetitive attempts on moves that force your hand to open under heavy load. This is believed to be one of the primary mechanisms of pulley injuries in climbers. Do some form of consistent and ideally measurable grip training to increase work capacity and resilience, whether that's on the wall or off it. Keep a log, even just a basic one. That allows you to get a better feel for your long-term progress and trends. For example, if your finger strength suddenly starts trending down and you can also notice some pain coming on, you can have an early sign that something is off. If you want to take the guesswork out of your recovery, save yourself a whole lot of time, and get a program that's specifically designed for your grade of injury, you can get that today on our website at hoopersbeta.com/recovery blueprint. These are the exact injury-specific programs I've used in my practice to help hundreds of climbers get back on the wall pain-free. They're step-by-step, day-by-day programs guiding you from the earliest stages of healing all the way to regaining full strength and returning to peak performance. Whether you're dealing with an A4 pulley issue or another finger injury, our recovery blueprints are a proven way to fast-track your recovery and get you climbing hard again. Remember to take advantage of that free finger injury assessment and use our affiliate code hoopersbeta to get $10 off the Pitch 6 force board. Until next time, train, climb, send, and repeat.